Your baby is pushing. Their little face turns bright red. They're grunting, crying, and trying so hard to poop, but nothing seems to happen. As a parent, it's heartbreaking to watch, and the first thought that comes to mind is my baby constipated? Not every baby who strains is actually constipated. In fact, many healthy babies grunt, turn red, and strain because they're still learning how to coordinate the muscles needed to pass a bowel movement. So how do you know the difference? And what should you do if your baby really is constipated? Let's talk about it. One of the biggest misunderstandings is thinking that babies should poop every day. The truth is, there's a wide range of what's considered normal. Some babies poop several times a day. Others might go a few days between bowel movements, especially if they're breastfed. If the stool is soft and your baby seems comfortable, they're usually not constipated, even if they haven't pooped for a couple of days. Constipation is more about how the poop looks and how difficult it is to pass, not just how often your baby goes. If your baby's stool is hard, dry, or comes out in small hard lumps, and they seem uncomfortable while passing it, constipation is more likely. So what can you do? The first thing is to stay calm. Most mild constipation improves with simple measures, but it's important not to give home remedies without guidance. If your baby is exclusively breastfed or formula-fed and is very young, don't give water, juice, or other foods unless your healthcare provider recommends them. For babies who have already started solid foods, your pediatrician may recommend adjusting the diet, depending on your baby's age and individual needs. One simple thing that often helps is gentle movement. Lay your baby on their back and slowly move their legs as if they're riding a bicycle. There's no need to rush. Just slow, gentle movements for a minute or two. This can sometimes help stimulate the bowels and make your baby more comfortable. Some parents also find that gently massaging the baby's tummy in soft circular motions helps them relax. Always be gentle, and stop if your baby seems uncomfortable. It's also worth paying attention to feeding. If your baby is formula-fed, make sure you're preparing the formula exactly as directed. Adding too much powder or too little water can affect your baby's hydration and digestion. If you're breastfeeding, continue feeding as usual unless your healthcare provider advises otherwise. Many parents worry when they see their baby turning red while trying to poop. Believe it or not, that's often completely normal. Young babies are still learning how to relax the muscles that help them pass stool while pushing with their tummy muscles. It can look like they're struggling, even when everything is working as it should. As long as the stool is soft and your baby is otherwise feeding well and acting normally, straining alone doesn't always mean constipation. However, there are times when constipation shouldn't be ignored. If your baby has blood in the stool, a swollen belly, repeated vomiting, refuses to feed, has a fever, isn't gaining weight as expected, or hasn't passed their first stool within the first day or two after birth, seek medical advice promptly. And if your baby is under a month old and you think they're constipated, it's always safest to contact your healthcare provider before trying any remedies. One thing you should never do is give your baby laxatives, suppositories, herbal remedies, or home treatments unless they've been recommended by a healthcare professional. What works for an older child or an adult may not be safe for a baby. When it comes to babies, it's always better to ask first. Seeing your baby struggle to poop can be stressful, but remember, not every grunt or red face means constipation. Watch your baby's overall behavior, pay attention to the texture of their stool, and don't hesitate to contact your pediatrician if something doesn't seem right. Most importantly, trust your instincts. You know your baby better than anyone else. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more trusted baby care tips every week. And tell us in the comments. Has your baby ever struggled with constipation, and what advice from your pediatrician helped the most? Thanks for watching, and we'll see you in the next video.